Hi, everyone. I'm Jill Feldman, and I'm one of the co-founders of the EGFR Resistors. We just held our sixth annual EGFR Resistors Research Summit, December 12th and 13th in Louisville, Kentucky. We brought together young investigators from all across the country who are doing work related to EGFR positive lung cancer. And as in the past, we had a fantastic group of 5 mentor judges who are leaders in lung cancer, chaired by Dr. Zosha Petrowska, who is with me here today. And they gave feedback on the young investigators' presentations and worked in small groups with all of the participants. This year, we were fortunate to have 15 early career investigators from all over the country as well that attended the summit. In addition to getting experience and presenting their work at the summit, the early career investigators truly benefit from the development of collaborative relationships between themselves and the mentor judges. I attended the summit and really enjoyed interacting with the young investigators, getting to know them, and hearing about all the exciting work that they are doing. It is incredibly exciting since these investigators are the future of research and EGFR positive research. So the EGFR resistors, started this summit in 2019 with the hope of creating this environment for early career investigators to foster relationships early in their career, to feel the sense of community, and to encourage them to continue their work in lung cancer and, of course, in EGFR positive lung cancer. Our first summit in 2019 was in person, and we transitioned to virtual formats for 20 and 21, and we have been back in person since 2022. And while we made the virtual summits very interactive as much as possible, truly being in the same room all together provides a tremendous opportunity for informal conversations, for networking, for collaborative discussions. And we do this through, breaks, but really also through the small table discussions that we had in breakouts. And this year, I think we had 3 breakouts. So it's really great to get a small group of 4 or 5 together and talk about whatever they want to talk about related to their career and their future. So next, Dr. Petrowska, who, as I mentioned, is chair of the EGFR Resistors Research Summit and one of our mentor judges, will summarize the research and the award winners from the summit. Dr. Petrowska?
Thank you so much, Jill, for introducing me and for that summary. And just to echo, I think this is a program that all of us look forward to each year. It's such a special event. I think it really, is unique in the sense that it brings back together patient advocates, faculty, and, really a wide variety of young investigators from all different backgrounds who are all united around this common goal of improving the lives of patients with lung cancer, and in this case, specifically an EGFR positive lung cancer. So it's truly such a pleasure to be a part of this program, to have been a part of the program since the beginning, and to watch it kind of continue on and grow every year. I think both you and I commented that over the years, we've now had young investigators who have come on the recommendation of past participants, which is wonderful to see. They're mentored by past participants, so we're really growing the generations of of researchers. So it really was a wonderful event. So, the program started on Thursday night. We all arrived in Louisville on Thursday night. We had an update. You delivered a wonderful update about the EGFR resistors that evening, and it was a chance to have an icebreaker for people to start to get to know one another on a personal level. And then Friday was really the day that we kind of spent together talking through research. We kicked off the day with another patient presentation by Diane Legg, who joined us virtually and really, I think, gave an incredibly moving and important talk on the importance of, the advances that have been made in EGFR positive lung cancer over the 20 years that she's lived with this disease, but also on how far we have to come in terms of the impact that the toxicities of treatment can have on patients' lives. And I think it was just such a wonderful way to start the day for these young investigators who, again, I think span everything from internal medicine residents to, basic scientists who are primarily in the lab and everything in between. And I think it was such a wonderful message. So going through some of the abstracts and specifically some of the young investigators that participated, the first part of the day was really focused on trainees and young investigators, and we kicked off the morning with Dr. Arthi Nair, who is a postdoctoral scholar in medicinal chemistry in the Korean lab at Vanderbilt. And her project really was focused on an exciting new flow cytometry-based method to study how specific EGFR mutations affect the activity of that EGFR resistors. And essentially, this is really a tool that she presented that can then be used to leverage and study the effect of various drugs on these mutations and to study drug resistance. I think there was a lot of excitement and interesting questions about how we can use this type of technology to study the next next wave of therapies for EGFR positive lung cancer. Next, following the theme of kind of more lab-based research, we heard from Cristina Jimenez, who was actually a PhD student also at Vanderbilt University. And her focus was also on really, developing novel methods to understand the structural biology of EGFR mutant lung cancers, and specifically of the EGFR and more broadly the HER protein family, which we know is a really important family in cancer development. So Dr. Jimenez is working on a method that uses something called nuclear magnetic resonance, or NMR spectroscopy, to study the kind of structure of EGFR and other HER family members and ones that have particular mutations that are known to be important in lung cancer, and looking at how they impact the interactions between these different proteins and how that then impacts downstream signaling. And again, here the goal is to really use biology to understand where might there be potential therapeutic vulnerabilities. How can we use this biologic understanding to develop better treatments for these patients? And I think both of these young investigators are really great examples of, I think, how the summit can impact both Dr. Nair and Dr. Jimenez are primarily in the lab. Unlike some of our other young investigators who are both in the clinic and doing research, these are incredibly bright and promising young scientists. And I think the impact of a summit like this really highlights and brings home for them the real world impact of their work. And I love about the summit. I think there's nothing more motivating than really seeing how important this work is to patients and to this whole community of patients who benefit from it. And
Yeah, and I just want to add, because I think one of the things that we as patients, when you talk about mutations, we think that all exon 19, deletions are the same, right? And you also think that if something is taken away, then it stops working, but this is the opposite. Because it actually makes the protein more active and makes the cancer grow. And so one thing that I learned is that, explaining it, I guess, protein, I guess the EGFR, the protein is a certain shape, right? And so it really, the deletion of the exon 19 changes the shape of the protein. And so it explains why the people respond, or the cancer responds differently to targeted treatments. And so, it's almost like we need an illustration to show how that works. It's really fascinating. I found that fascinating.
And you're exactly right. And I think, a theme that we've seen across this summit this year and in past years has been, something that we're also really interested in the clinic every day, which is how do we understand these different mutations and the impact they have on the structure? Because it's so very important for how we think about treating these. And sometimes we come across pretty rare types of EGFR mutations in these cancers, and we don't always exactly know how they're going to respond to these different therapies. And the structure is actually really something that we have to rely on. So these different tools that I think Dr. Nair and Dr. Jimenez and some of the other investigators are developing are so important because they can actually help us understand that structure more clearly, and ultimately I think then help us understand how to treat these cancers in a better way. And again, I think that's something that we saw in several abstracts, as you'll hear about today, but also in past years. I think this is a theme that keeps coming up and again and again.
Mm-hmm.
So next, we had really a wonderful young investigator named Dong-Hoon Shin. Dr. Shin is actually a second-year internal medicine resident at a small community hospital called Metro West Medical Center, close to me, actually, in Framingham, Massachusetts. Dr. Shin actually completed all of his medical education in Korea and recently came to the United States for his medical training. And he told us that he really came with the goal of pursuing a career in academic medicine and specifically in oncology. So he, I think, was really inspirational to all of us. This is someone who's working really, really hard. And we saw this with several residents across the program this year, working really hard, doing their medicine residency, which of course notoriously is some, a very, very busy time. And yet he still had the time to work on this project, which again was really focused on understanding the structure of various EGFR mutations. And in this case, really delving into the differences between different types of exon 19 deletions, which of course is a family of these exon 19 deletions. This is one of the most common type of mutations that we see in EGFR mutated lung cancers. But we also know that there can be different sort of flavors of EGFR exon 19 deletions. And right now we treat them all the same way. But what Dr. Shin is trying to understand is, are there differences in that structure and that shape that is related to these different exon 19 deletions? And if so, is that something that we could use to ultimately personalize treatment more for these patients? And I thought that was really exciting to see from a wonderful young investigator. I think, another big theme that we saw at this year's summit was abstracts focused on the study of brain metastases and leptomeningeal metastases from EGFR mutant lung cancer. I think we were all really happy to see this focus because we all know from the clinic and of course from this community that brain metastases and leptomeningeal disease are a huge area of unmet need for these patients. And so we saw a number of abstracts focused on, really defining better treatment approaches for patients with brain metastases and particularly with leptomeningeal cancer. So first among these was an abstract presented by Dr. Fangdi Sun, who is a third-year hematology and oncology fellow at Stanford University in California. And her project was entitled Pulse Dose Osimertinib for the treatment of leptomeningeal disease or refractory brain metastases in EGFR mutated lung cancer. This was a really interesting retrospective analysis of outcomes in patients who were treated with, I think, a relatively unique approach, which is intermittent or pulse dose osimertinib. So taking multiple pills of osimertinib every, maybe once a week or every few days, as a way to really kind of maximize the dose that is used to treat leptomeningeal carcinomatosis. I think it's important to highlight that this was a pretty small study. There were 14 patients in this study, and this was a retrospective analysis, meaning we kind of looked back at the charts of patients who had been treated in this way. But it did show that this type of pulse dosing of osimertinib can be manageable in terms of side effects and may potentially offer a treatment option for patients with leptomeningeal disease. Although, again, I think specific treatment and whether that's right for any individual patient is still something that I think we need more kind of prospective work to understand where this fits into our treatment paradigm. Um,
Yeah, and just with that one, I just want to reiterate the pulse dosing. You did a great job of explaining it, Dr. Petroska. It means you don't take the same dose every day. It means you take, well, in this case, a higher dose and pulsing it like you may take it on day one out of the week or day one out of 2 weeks, or it's just giving a really high dose, not every day. So it's really interesting, that concept. And, hopefully there'll be future research on it as well.
Yeah, and there's pros and cons to this approach. It's actually something that has been studied with older generations of EGFR inhibitors with erlotinib in the past. And again, there's pros and cons. And so I think that as we kind of think about the treatment options that we have available for patients with leptomeningeal disease in the clinic, I would say this is still pretty early days. This was a really small and retrospective study, but certainly something that I hope will be studied in future clinical trials as well. So next we heard from Dr. Jonathan Lee, who is also a hematology oncology fellow, this time at Weill Cornell Hospital and Cancer Center in New York. And his project was looking at the impact of osimertinib and cranial therapy on EGFR mutated lung cancer with brain metastases. This was a retrospective study really looking at outcomes of patients with brain metastases, both those that who presented initially, but also, and importantly, in patients who developed brain metastases already on osimertinib. And what he showed is that, there's different approaches that can work for patients here. So he also showed that a different kind of strategy of using a slightly higher dose of osimertinib, so 160 milligrams or 2 pills instead of the kind of standard, which is normally 80 milligrams, can sometimes work to control cancer in the brain for patients where this has arisen on the standard dose of osimertinib, but also chemotherapy can have a benefit and can be used as a tool. And then, of course, radiation as well. So I think this really reflects the different tools that we use in clinical practice now and tries to get at, the benefit of these. And so, I think that these types of studies really try to help us understand how are these therapies working in the real world. How can we learn about which of these therapies is best? And that's so important. Continuing along the same theme, as you can see, there really was a number of studies in this area, which is terrific. We next heard from Kelsey Pan, who is a senior fellow in thoracic oncology at MD Anderson Cancer Center in Houston, Texas. And she collected, I think, a really impressive and large retrospective global cohort of patients with leptomeningeal disease, specifically in EGFR mutated lung cancer. I think this was particularly exciting and interesting because we generally think of leptomeningeal disease, or LMD, as something that is a relatively rare event. So, most of the studies that look at this are relatively small. Yet in this series, they were able to collect data for nearly 400 patients that had LMD from EGFR mutant lung cancer from the United States, from Switzerland, from China, so also a global cohort. And I think this study highlighted something that we've certainly seen bear out in clinical practice, which is that CNS penetrant EGFR inhibitors like osimertinib, and there are some others that are used, for example, in China, can be really effective treatments for these patients. But it also, I think, emphasized the fact that we don't have very good treatment for patients who develop leptomeningeal disease on those kind of brain penetrant targeted therapies, and really emphasize the need for more effective therapies in this patient population. And finally, in this kind of section of abstracts, we also heard from Dr. Mark Zhang, who is an oncology fellow at Memorial Sloan Kettering Cancer Center in New York City. And he presented the design of an upcoming study. So I think this was really nice to see, a few different kind of series looking back at what's happening to patients, and now a study that's being developed and soon will open, prospectively looking at optimal ways to treat brain metastases. So this is a phase 2 randomized trial of intracranial consolidation or deferral of radiation in patients with EGFR mutant lung cancer receiving appropriate CNS active systemic therapeutics, or the ICON-RT study. And so in this study, it's actually for patients with newly diagnosed EGFR mutated lung cancer and brain metastases found when they first present with cancer. And this is a small study in New York that will actually randomize or assign patients by the flip of a coin to do 2 different approaches. All of them are going to get a CNS penetrant or kind of a drug that works in the brain, which is osimertinib, but then half of the patients are going to get what's called consolidative radiation. So actually focused radiations to areas of cancer in the brain after a few months on treatment, while the other half of the patients are going to be monitored very closely with serial brain MRIs, and radiation would be used kind of later on if they have growth of those lesions rather than upfront. And so I think this is a really interesting question of how do we integrate radiation into treatment? There's good and bad with radiation. And so, do we need to think about it up front? Should we save it for later? But also really exciting that they're incorporating some exciting, what we all call correlative studies. So in this case, they're collecting plasma or blood samples from patients to really learn as much as possible for the patients who are participating in this study, and try to develop some blood-based signatures, which may help identify which patients, kind of need that radiation up front, and how can we really learn more about these cancers up front from a blood test to help personalize treatment.
Did he mention, Dr. Petroska, when that, because that'll be the first question people in the community will ask, is when will that trial be open? Near future, meaning in the next month or year?
I think I think what he said was that it was fairly close to activation. So I think in the coming months, this is a study that he's developing actually with one of the faculty members who's also been a long-term participant in the program, and a good friend, Helena Yu. And this, just to say, this is a study that's only being opened actually at Memorial Sloan Kettering. So really, I think, somewhat geographically limited, but definitely an exciting type of trial. And I think really importantly, will also inform, how we take care of patients in the future. But I think coming soon.
Okay, stay tuned.
Exactly. So next we heard from Radhika Gutta, who is a hematology oncology fellow at the Henry Ford Health System in Michigan. And she is studying, I think, a really interesting question, which is, are there differences in the types of EGFR mutations and co-mutations that we see in EGFR mutated lung cancer that occurs in various ethnic and racial groups? She is doing an analysis using a data set from one of the molecular profiling companies called Tempus, and really, trying to understand, if we look at EGFR mutant lung cancers that arise in Caucasian patients versus Asian patients versus African American patients, are there differences kind of biologically between those cancers? Still early days, but she did show some interesting data that perhaps some of the co-mutations that arise in these cancers may be different among these different populations. I think this type of work is really interesting. I think it's also going to be important to really look at that even more broadly, not just in the United States, but really around the world. We know that EGFR mutant lung cancer can arise in patients of lots and lots of different backgrounds. So I thought this was a really interesting project. We then heard from Sarah Waliani, who is a second-year oncology fellow actually at my institution. I'm lucky to work with her at Mass General. And she presented, I think, an interesting analysis looking at the frequency of EGFR mutations, but also of other genomic alterations in a subtype of lung cancer that's different than the typical non-small cell lung cancer or lung adenocarcinoma that we usually talk about. In this case, specifically looking at patients who have lung carcinoid tumors. These are relatively rare tumors that fall into the neuroendocrine family of cancers and can arise in the lung. And in the past, we haven't thought of lung carcinoid tumors as a type of cancer that tends to have mutations in EGFR or ALK or others. But Sarah actually showed that in a subset of these carcinoid tumors can have EGFR mutations and ALK rearrangements and other alterations. And I think really importantly, also showed that these tumors, when they have these different alterations, can respond to the targeted therapies. And so I think this work is really important for the lung cancer community because it highlights the importance of molecular testing, not just in lung adenocarcinoma, where I think most of us, are already doing it, but looking across these kind of more rare lung cancer subtypes where maybe molecular testing isn't being done as routinely yet, but occasionally can pick up something that's really, really impactful for patients.
Mm-hmm. I think that's so important and so interesting that we don't think about outside of non-small cell lung cancer, adenocarcinoma. I really like
And
that.
it's a message I think that needs to get out to the broader lung cancer community, right? I think this is something that we talk a lot about, who should be tested. And I think the short answer is we hope that everyone gets testing at some point, because it can occasionally really kind of change the course of a patient's cancer.
Exactly, yeah.
So next, we heard from Shimong Liu, who is a PhD postdoctoral fellow at MD Anderson Cancer Center, actually a mentee of one of our faculty members, Dr. John Haymack. And Dr. Liu is studying, again, kind of coming back to this theme of different types of EGFR mutations. She is studying atypical EGFR mutations, and in particular, a group of mutations which we call the PAC or PACC mutations, based on the kind of the structure, again, that shape of that EGFR protein that these have. Dr. Haymack and his lab kind of coined this term, the PAC mutations, to describe a group of these unusual mutations that have a particular structure. And so we understand some about the PAC mutations, but there's still a lot more that we need to learn, particularly about their biology and their therapeutic sensitivity. One of the challenges in studying these mutations is that they're generally thought of as pretty rare. But I thought what was really neat about Dr. Liu's project was that working together with Dr. Haymack and again, some of these molecular diagnostic companies, they were able to assemble a huge cohort, over 1,700 patient samples with these rare mutations. And so they're using that cohort to study, first of all, the frequency of these mutations. Are they arising as individual mutations? Are these compound mutations where you see co-occurrence of these different mutations? And then also using this data set to study the sensitivity of these various mutations to different EGFR inhibitors. And there was a lot of discussion among the faculty panel and among the whole group about how this type of work really provides an opportunity for us to get important data about how rare types of mutations respond to these different drugs that can then help us, when we see that next patient in the clinic who has a mutation where perhaps we don't have as much kind of information about the best way to treat it. Can we look to data sets like this to help us, try to pick what might be the best type of EGFR inhibitor to use? So I think this type of work really may have an impact for those of us treating patients with EGFR mutated cancer in the clinic. Next, we heard from another oncology fellow from Memorial Sloan Kettering Cancer Center, Jessica Stewart. She presented, I think, a really interesting and exciting analysis about something called MTAP deletions in lung cancer. So MTAP or MTAP protein deletions have recently been identified in a subset of lung cancers, not just in EGFR mutated lung cancer, but across all non-small cell lung cancers. And they're important because they seem to be kind of a therapeutic target, meaning that cancers that have these MTAP deletions seem to be more sensitive to a class of drugs that's now in early clinical trials called PRMT5 inhibitors. When you have an MTAP deletion, this leads to something we call a synthetic lethality, or kind of a particular therapeutic vulnerability to inhibitors of this PRMT5 protein. And so, we've known about MTAP deletions for a while. There are a number of these PRMT5 inhibitors that are now being developed and in clinical trials. But what Dr. Stewart showed was that actually often these MTAP deletions can occur together or occur in EGFR mutated lung cancers, as well as lung cancers that have other kind of oncogene alterations. And in particular, in the case of EGFR mutated lung cancers, in their cohort that they looked at from Memorial Sloan Kettering, they saw that sometimes these alterations can be present at the time of their resistance to initial TKI therapy. And so clinically, I think this is really exciting because it means that patients who have, for example, progressed on osimertinib, who have an MTAP deletion, that may be a therapeutic target. We can think about, whether those patients may benefit from one of these PRMT5 inhibitors on clinical trials. And I think this is an area where I expect that we'll see more research and more clinical trials being developed in the coming years. So
that's what we need, right? We need to find out how to overcome and or treat resistance. That was really interesting as well.
Yeah, and kind of a new pathway, one we haven't heard much about in past years. So I think always really exciting to see that. Jill, I was particularly excited to hear that our next presenter, Emily Payton's work was inspired actually by a conversation that she had with you. So Dr. Payton, she's a internal medicine resident at Oregon Health and Science University in Portland, Oregon. She actually had just recently matched to oncology fellowship. So she is, well on her way to becoming an academic oncologist. And what she shared was that she had had a conversation with you and I think some other patient advocates about the limitations of some of the current metrics that we have to measure adverse events in clinical trials. And of course, we all talk about this quite a lot about, how important it is in clinical trials, not just to study how well a drug works, but also what is the impact of that drug on patient quality of life, patient day-to-day life. And we know that those kind of toxicity tables that say, 75% of patients had diarrhea, X% had grade 1, grade 2, it doesn't really fully capture the impact that those toxicities have on patients and their lives. There are some tools called patient reported outcomes, or PROs, which are surveys and kind of questionnaires that are given to patients on clinical trials to try to get more in depth and the kind of assessment of that impact of those PROs. And so Emily, and I'm sure you can kind of chime in more about this, but has worked with the EGFR resistors, with the Longevity Foundation and other, I think, to really answer a really interesting question of how well are these PRO tools, these questionnaires that we're using, really assessing and capturing the outcomes that are important to patients, and the key side effects that we need to look at to really understand the experience of patients. And so she studied a number of different tools that are being used, a number of different PRO kind of questionnaires. And she was able to show, I think, in a nutshell, that they all have strengths and limitations, that some of them are better at capturing particular types of adverse events or side effects than others. Some of them are better at capturing kind of the functional limitations that patients might experience than others. And that probably no one tool is really, adequate, and that we need to do better with all of them, but kind of combining different tools gives us the best assessment. But I know this is a project that you were involved in from the beginning, Jill.
Yeah, yeah. And that's, one of the things that we realized through our community and discussions and experience is that these tools weren't built when we had targeted therapies. They were built when generally we were using chemotherapy to treat patients. So there are certain side effects. For instance, they talk about nail stuff, but they don't talk about paronychia, which is the infections that sometimes, get really bad. Or they talk about, kind of mouse sores, which from my understanding can be a little different than mouse sores from other treatment, and not really capturing the impact of, may not impact everyday life, but it does impact a nutrition intake, which, as a rule, people on targeted therapies, very small percent lose weight from the therapy as compared to other therapies. So, it's the first step in really trying to tailor these PROs to fit the newer therapies. And it's really important to understand that, so we understand what the lived experience is, and we can better mitigate, be proactive with side effects, and it benefits everybody, right? Like, people live better, people stay on treatments longer. And so it's not just about surviving. People want to live their best life in the context of having lung cancer. So it was a lot of work what she did, really going through all the drugs and the labels. So it was, yeah, very impressive. And, we're talking about next steps. So that's exciting.
It's awesome. And again, a lot of work that she did as an internal medicine resident, when we all know how busy that is, working 80 plus hours a week in clinical duties. So really awesome. And I think, the other thing that's amazing about this type of project is I think it really kind of epitomizes what the impact of having patient advocates be a part of, lung cancer research has helped us to better understand. And, you and I talk about this a lot. I think 20 years ago, 30 years ago, research was research, and it was really driven primarily by investigators and by pharmaceutical companies, and patient advocates didn't have a voice at the table. And I think that, that addition of patient advocates as really key stakeholders has enriched and improved the way that we study, these therapies. Of course, we still have a long ways to go. And again, I think that this research summit really kind of emphasizes that. And I think it teaches that next generation about the power of this, hearing Diane speak at the beginning of the day, hearing about these things and talking about them. It's really awesome. And I think it's one of those things. It's kind of like my kids and their iPhone. It's innate to them. Like they don't know it
Right.
any other way. But
Mm-hmm.
I think it's important to say that it wasn't always like this, and we're really lucky. I think,
Yeah.
as researchers and as patients and as the whole community to be able to learn from one another.
Yeah, definitely.
So the next couple of abstracts were from junior faculty. So unlike many of the young investigators who are still in training, Dr. Babak Prang is a physician scientist and junior faculty at Weill Cornell Hospital in New York. He's a lab-based investigator, but also a clinician. And he presented, I think, a really interesting lab-based project in which he is trying to, like many investigators are, to develop ways to target this population of cells that we call drug tolerant persister cells, or DTPCs. And you might have heard this term used before. Basically, it refers to cancer cells that basically kind of survive and almost hibernate during targeted therapy. We know that these drugs aren't eradicating these cells, that some of them are kind of surviving TKI therapy, and maybe the seeds of resistance. So always there's this question of, can we add other therapies to eradicate those cells more effectively, and might that help these therapies work more effectively and for longer? His project was really interesting because he, started by targeting kind of thinking about a particular pathway, this SRPK2 pathway that he thought might be important in these drug tolerant persister cells. And he found that actually a drug that we commonly use to treat ALK positive lung cancer in the clinic, alectinib, might kind of target this pathway and might enhance the efficacy of osimertinib. And so in the lab, he did experiments in kind of cell line models to show that indeed osimertinib and alectinib worked really well together. But then he told this beautiful story of when they actually tried to understand why this is, and is it through this pathway that they had kind of hypothesized might be the case, they found that it really didn't seem to be. And he, I think, did a really beautiful job of presenting his work, then trying to understand if alectinib is really enhancing the effect of osimertinib in these kind of cell line models, why might that be? And he's identified a new pathway that may play a role here. I think, again, still early days, but this was the FER signaling pathway. And what I really struck me about this presentation was, I think he had all of us on the edge of our seats as he presented this very kind of basic science work, and he kind of walked us through the whole thing. All of us were saying, well, why does alectinib work? What's the mechanism here? And that's not always easy to do when you're presenting, really kind of bench science to an audience that includes a lot of clinicians and people of all different backgrounds. So this was really great. And also, this is something that's being translated into a clinical trial that's planned at Cornell that's going to be looking at the role of alectinib in the setting and in the clinic. So I think really nice to see that bench to bedside kind of translation as well.
Yeah, that it was, I was on the edge of my seat as well, because you thought you were going to hear an answer, and it's really important. And I think he did a great job of saying, we don't know why, but here's what we see. And there is reason to study this further. And so, and especially because we look at kind of sometimes these main mutations as mutually exclusive or very, very rare. Well, it's not even targeting a mutation. So now there's a whole different, way, I guess, that this drug can help people with EGFR cancer without targeting ALK. And so it opens up a new way of thinking as well with some of the mechanisms, these drugs, and how they target.
Absolutely. And we know that a lot of drugs, we talk about them as an EGFR inhibitor or an ALK inhibitor, but it's never so simple as that. Many of them will have also, we call them off-target effects, and sometimes that actually explains some of the side effects that we see with these therapies, but it also means that they can sometimes be repurposed, in other settings than where we might use them. And always, I think that's a nice thing to see, because sometimes, it's a drug that you already know, and how it works in patients in terms of side effects. And, you kind of are already starting a little bit ahead because you have some clinical experience that you can bring to that work. And then, of course, you have to study, for example, how is that drug going to interact with a drug like osimertinib? Is this even
Right.
going to pan out? Something that pans out in a petri dish doesn't always work as well in patients. Is it going to work well in terms of side effects? There's lots of questions that will come from this work, but really exciting to see. And so next we had another junior faculty member, actually again from my own institution, Dr. Catherine Metter, who I'm privileged to work with at MGH and who's actually also participated in the EGFR Research Summit in the past. I think this was really awesome. We had a number of returning young investigators, and I think it really speaks to this community building and how much they gain from these programs. So Dr. Metter presented on some work that she's been doing to develop more effective tools to detect transformation to small cell cancer, which we know, of course, is a known resistance mechanism to EGFR inhibitors, including osimertinib. But currently, one of the challenges with small cell transformation is that we can only detect it based on a tissue biopsy. So you really need a piece of that tumor that a pathologist can look at under the microscope and say these look like small cell carcinoma cells and not like adenocarcinoma cells that they did before. But we also know, and patients know this better than anyone, that tissue biopsies can be really challenging to obtain. They're not always feasible. They have a risk. They means that patients have to go through another procedure and wait for the results when they're, going through a difficult time, when they've just been told their treatment may not be working as well. And so I think it's really important that we try to develop better tools to more quickly and easily detect these small cell transformations. And in particular, there's a lot of interest in the use of liquid biopsies or blood-based tests here. So Dr. Metter and her colleagues have been developing a pretty exciting method that's blood-based. So this is a liquid biopsy technique that uses something called epigenomic profiling of circulating tumor DNA. So basically taking circulating tumor DNA, which is something we do a lot in the clinic, but actually looking at kind of how some of the important genes are expressed. Is there a lot of them being expressed or less? And looking at these gene expression signatures in patient plasma. And so in this pilot study, they took plasma from patients who had a small cell transformation detected on a biopsy, and they were able to kind of hone in on particular gene expression signatures that were seen in the plasma of patients that had that transformation and not seen at before that transformation occurred. And they were able to kind of develop a particular small cell signature, they said, that could be detected in patients who had small cell transformation. So this is still work that's in pretty early stages. This was a relatively small number of patients, and this is another situation that these are not so common, so it's not always easy to get kind of a big cohorts of patients with small cell transformation, but I think this is really promising, and I think this has the potential to really change how we diagnose small cell transformation and make that diagnosis more quickly, and importantly, without the need for an invasive tissue biopsy. So I think there's a lot of potential here, and something that I look forward to kind of seeing in larger studies as well.
Yeah, it's been an unmet need in the community for a while, and this really is an exciting project. So we'll look forward to seeing that move forward too.
Absolutely. Lots of projects that we're excited to see forward at the summit. And so finally, our last presenter of the day that rounded out a really exciting day was Louis Filipiak, not a junior faculty, but another trainee, another medical resident. Again, a number of medical residents joining us this year, this time from Rush University Medical Center in Chicago, Illinois, where he's mentored by one of our faculty mentors, Dr. Fiddler. And he described his work looking at baseline patient characteristics and how they impact outcomes of patients with EGFR mutant lung cancer. He showed that increased kind of physiologic stress, something that he described as allostatic load, which is basically kind of a measure of the physiologic stress that can have to do with other health conditions. So other health problems, high blood pressure, higher body mass index, other kind of health conditions and other factors potentially may have an impact on outcomes on treatment of their cancer. And so I think, this is something that in some ways seemed intuitive, that the more kind of, other kind of health problems and patients have, that may have an impact on how their cancer treatment goes. But I think it also really kind of highlights the potential role of interventions that may be aimed, for example, at lifestyle modification and incorporation of regular exercise into how we kind of think more holistically about how we treat patients with EGFR mutant lung cancer. And this was, I think a lot of us were really excited when the discussion about this abstract with Dr. Filipiak, and there's a lot of exciting work being done in this space to think about, the role of exercise, the role of overall well-being in patients' lives. And I personally am really excited to see this as a focus of this kind of more holistic approach to how we treat and take care of patients with EGFR mutant lung cancer.
Yeah, I found it fascinating too. I didn't know what an allosteric, I didn't know what that even meant, but
Neither did I, Jill.
okay, good. But what I really appreciate is, we're not looking at one metric, right? And we're not just looking, precision medicine often focuses just on the molecular level, and this is looking at the whole person. So I think that is huge. It's very, very important. And, moving forward, I hope to see a lot more research done in this area. But next, before Dr. Petroska announces the research awards, I want to take a moment to honor Ivy Elkins, who this, usually is on this wrap up with me. As many of you know, Ivy was co-founder of the EGFR resistors. She was diagnosed with lung cancer in December 2013 and sadly passed away this past June. Ivy was a relentless advocate who embodied the essence of patient-centered research and care. She was an integral part of shaping the EGFR resistors research partnerships and this summit. And so Ivy's impact was profound, both in research and in changing lives in a moment by sharing her knowledge and hope. And those who were fortunate enough to know Ivy know that her infectious laugh and her magnetic personality could really light up a room. So we wanted to honor Ivy, and what we did was this year we changed the Distinguished Investigator Award for this year and moving forward to the Ivy Elkins Award to honor Ivy, the incredible person she is, the work she's done, and the inspiration she continues to provide. And so stay tuned for the who receives the Ivy Elkins Award.
Yeah, just to echo that, I was one of the fortunate ones who got to know Ivy over the years of the EGFR Resistors Research Summit. I think she was missed so much this year, but I think you did a beautiful job of really, capturing her spirit and describing it. And, I think she was in all of our hearts and our thoughts at the summit. And I think, again, another generation of young investigators, I think, were touched by what she did and what she accomplished and what all of you kind of do through the EGFR resistors. So I think it's really, perfect that we named the award after her going forward. So, but that wasn't the only award that we presented. We had a number of awards, and actually, based on how impressed we were with the many young investigators, and all of the work that they're doing, again, sometimes doing it while being residents, sometimes doing it while, carrying on a faculty career, so many different, kind of challenges that everyone's facing and still managing to put forth excellent work. I will also say, I think one of the comments that all of the faculty made was that not only were the abstracts and the projects really impressive, but the presentations were excellent. One of the great things about the Young Investigator Summit is that it also includes actually presentation coaching, which is an awesome, thing for these young investigators. I think giving a good talk and learning how to present is a skill that many of us learn on the fly. It's not something you learn in medical school. It's not something you learn in residency, but suddenly it becomes incredibly important because your work is only as good as, how you're able to communicate it and present it, and knowing how to present to different audiences, people of different backgrounds. Those are such important skills. And this group, I thought, really did a fantastic job overall of, their presentations as well as their projects. So they all get a gold star. But we had to pick some winners, and these, were judged by the faculty judges based on, innovation, scientific impact, clinical impact, and then also presentation. So the scores were tallied, and we awarded 2 honorable mentions. And these were really projects where we kind of felt that these were young investigators who had risen to give great talks, often kind of earlier in their career path. So the first went to Cristina Jimenez, who was a PhD student, still working to get her PhD, and her project was evaluating the structural basis of non-small cell lung cancer and mutant dimerization within the trans and juxtamembrane region of EGFR and HER2. And again, she did a really wonderful job of presenting this work, but also we thought the work itself had a lot of potential to help us, kind of develop new treatment strategies for patients. And the second honorable mention went to Dr. Dong Hoon Shin, who was a second-year medical resident from Metro West Medical Center, and to his work looking at the comprehensive analysis of EGFR exon 19 deletions, sequence epidemiology, and molecular architecture, insights into non-small cell lung cancer therapy. So again, I think, this was really someone who impressed us with his drive to do this work while coming to internal medicine residency, and also the potential for impact for understanding these different exon 19 deletions. And then in terms of the awards, we awarded 3 awards in total. The first was a second runner-up award, which went to Dr. Babak Parang from Weill Cornell on his work in inhibiting SRPK2 eradicates EGFR mutant drug-tolerant persister cells. This was the project that really, is looking at the role of alectinib as possibly eradicating that drug-tolerant persister cell population. He did a wonderful job presenting the work, as you already heard, but also we thought this was a project that was really exciting, and we look forward to see it kind of translate into the clinic. The first runner-up went to Dr. Jessica Stewart, also from New York, a fellow at Memorial Sloan Kettering Cancer Center, for her work on the genomic landscape of MTAP deletions in association with EGFR alterations in patients with advanced non-small cell lung cancer. This is a beautifully presented project, but I think also, everyone was excited to see that this is a potential new kind of treatment, that we didn't really appreciate may have a role in acquired resistance to EGFR targeted therapies. And so I think this is an area that also holds great promise. So congratulations to Dr. Stewart. And then finally, the grand prize of this meeting, the EGFR Resistors Summit Ivy Elkins Award, went to my colleague, Dr. Catherine Metter from Massachusetts General Hospital, for her work on detecting small cell transformation in patients with advanced EGFR mutant lung adenocarcinoma through epigenomic circulating free tumor DNA profiling. So again, that was the work really looking at the role of liquid biopsies to help us make that diagnosis of small cell transformation more easily and more quickly. And we think that, that has something that really has a potential for direct patient impact. So I think, they were great prizes. I was really proud of all of the applicants, or all of the young investigators, but especially of the awardees. It was really wonderful to see.
Well, thank you, Dr. Petroska. That was a fantastic summary of all that was done at the EGFR Research Summit. And I think really illustrated what I said before, which was the future of EGFR lung cancer. The future of lung cancer is bright. And so thank you all for being here with us and listening. As you can tell, this summit has a significant impact on advancing the professional development of the next generation of lung cancer researchers through the people they're meeting at the summit, the work they do, but really it provides this intimate setting where they can have all these different opportunities to interact with each other, with key opinion leaders, with advocates. Many of them had never worked with advocates, and it really is inspiring, and it's a testament to why these small, intimate summits are important. And once again, this year, it filled my heart with hope and gratitude. And of course, I want to recognize the unwavering support from all the mentor judges, for creating the safe space for the early career investigators to learn and to grow, to really collaborating with us, the patient advocates, and for their enthusiasm towards this program. I mean, this is what these early career investigators, they don't come to see the advocates, they come because the key opinion leaders are there and they get to talk to them. But it really is amazing. And of course, the summit is only possible because of the critical assistance of CEC concepts, your tireless efforts, your creativity, your patience with us, and the amount of energy that you put into making this a meaningful, successful event is nothing short of amazing. And I just thank you from the bottom of my heart. And also, this summit would not happen without the generous grant funding from AstraZeneca. And we are just so grateful that they see the value provided in this summit. We are thankful for, our partnerships with both CEC and AstraZeneca over the past 6 summits, and look forward to many more years of continued collaboration on this important event. So thank you on behalf of the entire EGFR research community.
And thank you, Jill. I think you have to be recognized. You put so much heart and work into this summit too. So I think, your contributions cannot go unnoticed too. I think we're all grateful to work on this together.
Thank you.